Hello po muli. Papatuloy natin ang ating pag-aaral, pulse diagnosis. Nandito na po tayo sa pain pulse, minute or Wei Mai. Pain pulse. The weak pulse is also called the minute pulse. The weak pulse is more extreme version of the fine pulse, and it is even thinner, weaker, and softer. The pulse can be can be difficult to palpate because it is so weak. So mahirap po talagang kailan nakakonsentrate po kayo dito pag nagpupulso and thin. So the diagnostic significance of the dynamics are the same as those for the fine pulse. The pain pulse is seen when there is extreme Qi deficiency, blood deficiency, and yin deficiency. It will always be the chronic condition. So mga delikadong kondisyon na po ito, nararamdaman natin yung pain pulse pag mayroon ng matatagal na sakit o may mga chronic condition. Pain pulse pattern of imbalance, extreme Qi deficiency, extreme yin deficiency, extreme blood deficiency. Typical combination, faint and rapid. Extreme yin deficiency, heat. Faint and slow. Extreme Qi and blood deficiency plus cold. Faint and choppy. Extreme blood deficiency. So description po ng pain pulse, the vessel is extremely thin and forceless. It seems to be felt and then not felt. So pwede nyo maramdaman, then nawawala. When freezing deeply, the vessel and pulse become vague. So key points po, thin, forceless, and vague. Other translation, minute. Yan po yung pain pulse. Pulse quality, halos wala po yung lakas, mahinang-mahina. Then thin. So description, the minute pulse is very thin, almost blurred. It's basically an extreme case of fine pulse and is most imperceptible under the fingers. Halos hindi po nyo mararamdaman sa inyong kamay. Indication, pag meron pong yin, yang, qi, or blood deficiency syndrome. Biomedicine, yung sobra pong nagbabamit, profuse sweating, at saka blood loss. Pathogenesis, the pain pulse is a sign of Qi and blood deficiency. The Qi and blood are too weak to fill up and drive the pulse. So sobrang napakahina po at napakakaunti kaya hindi halos wala nang laman yung yung ugat. So it is a sign of decline. If the pulse sensation is lost at the superficial depth, nagsasabi po yan na ang yang ay sobra nang mababa na yung level. Yang is in decline. Yun. If heavy pressure causes the pulse to be lost, nagsasabi po yan ng exhaustion of yin. Yan po yung pain pulse. So clinical significance, the minute pulse indicates severe deficiency of blood, essence, or yin. It may also indicate deficiency of the original Qi. So it is only seen in chronic condition and it indicates a poor prognosis. It is often seen in cancer. May mga cancer pong pasyente, So the common condition that present with minute pulse include hemorrhages, spontaneous sweating, nocturnal emission, chronic diarrhea, menstrual disease, collapse of yang, and chronic vomiting. Ito po yung mayroong mga minute pulse. Summary of clinical significance ng minute pulse. Ito po yung may mga severe blood deficiency, yin deficiency, essence deficiency. So combination po, pag minute and rapid. So nagsasabi po yan ng yin deficiency with empty heat. Minute and slow indicates severe Qi and blood deficiency with internal cold. Si slow. Yan. Minute choppy indicates exhaustion of blood. Minute saggy indicates Qi and blood deficiency with some dampness. Minute deep indicates yin deficiency. Minute wiry po sa liver yan. Laging affected ang liver. So meron siyang liver yang rising, occurring against the background of severe blood deficiency. Tumataas yung yang ng liver dahil kulang na ng dugo. Differentiation of similar pulses. And fine. The minute pulse is nothing but an extreme case of fine pulse. Ang minute po mas matindi kaysa sa fine. So it is simply thinner than the fine pulse. Mas manipis ang minute. So thin pulse. The pulse is very thin and feels like a fine thread, but it is very distinct and clear without interruption or rhythm when pushing on the pulse. So key points is small and thin, clear and distinct. Binabalikan lang po natin uli yung mga pinag-aralan natin nung nakaraang gabi. So other translation po nito, fine, thready, this is called the small pulse and is regarded as the opposite of the big or large pulse. So pulse-image thin, kabaliktaran ng mga big or large pulse. So indication po no, ng thin pulse, deficiency sa chi, sa blood at yin. Pwede ring may excess due to dampness. So biomedicine, heart failure, yung may mga early stages of shock, minor asthenia, severe hemorrhage, of upper digestive tract, may mga serious nosebleed, serious hemoptysis, hemorrhage of intestinal tract, hemorrhage due to rupture of ectopic pregnancy. Yung mga tinutubuan ay nagbubuntis po nang wala dun sa matres. Yan. So pathogenesis, the blood or yin deficiency falls to fill the blood vessel. Deficient chi is unable to promote blood circulation, which also prevent the blood from filling the vessels. So, pag dampness naman po, dampness accumulates around the vessel, compressing its width. Yan, binabarahan ng damp yung ugat, kaya hindi nakakadalo hindi napupuno ng dugo. Biomedicine, insufficient blood volume, reduce effective volume of blood circulation. Siyempre, kung kulang nga yung dugo na pumupunta dun sa ugat, konti din yung may circulate. So the vascular bed is contracted through the regulatory function of the neurohumoral mechanism. So another potential explanation is a fall of the cardiac stroke volume, which cuts down intravascular pressure and makes the small and medium-sized arteries contract. Remarks po, the thin pulse is more commonly encountered in the female than the male. In those of smaller constitution, a thin pulse is not considered pathological. Sa mga mapapayat, minsan talagang parang normal na thin pulse ang mapapayat. So ayan po yung weak. The weak pulse is deep and soft, but not so thin and imperceptible as the minute pulse. Balikan po natin yung frail pulse. The pulse is forceless, deep, and thin. It can only be felt on the deep depth by pressing it. More pressure is applied. The pulse is lost. Yan, pag yung frail pulse, habang dinidiin mo, nawawala. Deep, thin, and forceless. So other translation is weak. Yan po yan, yung frail pulse. Wala po siyang lakas. Hindi masyadong lumalaban sa inyong fingers. Pag dininin nyo sa pulsuhan ng inyong fingers, hindi nyo mararamdaman sa mga gilid. Kailangan nyo idiin para maramdaman nyo sa pinakang deep level. So indication po niyan, yin-yang or Qi blood deficiency syndrome. The frail pulse is a sign of Qi and blood deficiency. The Qi and blood are too weak to fill up and drive the pulse. So it is a sign of decline. If the pulse sensation is lost at the superficial level, so pag pinatong yung kamay nyo, then nawala sa ibabaw pa lang, nagsasabi po ito na ang inyong yang ay sobra nang mahina, decline. Pag dininan pa ninyo at nawala ang pulso, nagsasabi po ito na pati ang inyong yin ay exhaust na. Exhaustion of yin. So nangyayari po ito in biomedicine kung sobra ang pagsusuka, pamamawis, o sobrang nawalan ng dugo. Yan po yung nagkakaroon ng frail pulse. So yung clinical significance, according to Lizzie Shen, so prone position, breathlessness and palpitation. Middle position, abdominal distension and fullness ng stomach and spleen deficiency. Kasi middle, andun yung stomach and spleen. Sa rare position, kidney and urinary bladder. So deficiency of blood, exhaustion of essence, diabetes, and abdominal pain. Balikan po natin yung minute. Yan ang minute pulse. Superficial and middle and deep. A pulse which is very thin and very soft is called minute pulse. It is like a fine thread. It breaks when pressure is applied. Pag dininan mo, nawawala. And becomes intermittently indistinct, fading in and out. Even though it is only vaguely felt by the tips of the fingers, its rhythm remains constant. So, pulse comparison. The minute pulse must not be confused with the thin pulse. Minute pulse is intermittently indistinct, whereas the thin pulse is little bigger and clearly felt. So, yun po, yung minute, mas maliit talaga siya. Yung thin, mas malaki ng konti. Mas nararamdaman mo ng konti. The minute pulse is caused by failure of yang qi, whereas the thin pulse is caused by deficiency of qing blood. Blood. Clinical significance, whenever there is a deficiency of blood and qi, especially when there is deficiency of yang qi, the pulse will be minute. Yun, pag kulang daw po ng ang blood ng qi at yung mismong yang natin, kasi yung yang, yun din yung ano ng qi, yung po nagiging minute ang pulso. When yang qi is weak and deficient, or the body surface is not consolidated, there are usually deficient symptoms like fear of cold. Yun, nakakaramdam takot ka sa lamig. Yan. Fever and excessive perspiration. Sobra kang mamawis. If the 5 types of fatigue and the 6 types of extreme fatigue in men and in uterine bleeding and vaginal discharge in women, the pulse is usually minute. This is due to qi and blood both being deficient. So yun po, pag nagkulang ng qi at blood, minute pulse. So kung guan qi, yung position po nito So yung dyspnea, caused by lung qi deficiency, nahirapang huminga, and fright, caused by heart qi deficiency, will reflect in a minute pulse felt at both cone position. Kasi yung cone position, yung ating heart and lungs. When the transporting and transforming function of the spleen and stomach are damaged by deficiency, and there are symptoms of stuffiness and distension, the minute pulse can be felt at both one position. So when the kidney Yuan Yang is damaged with cold body and painful abdomen, or when Jing blood is deficient and damaged with triple parching, the minute pulse can be felt at both qi position. Kasi alam naman natin na yung qi position, yung kidney yin and kidney yang natin yan. Thank you po for your attention.